Yes.
All right, guys. So I'm going to just show you the case and you can ask me whatever you want. Um, so instead of leading you to anything, I'll have you ask me questions.
Where's the specimen from?
Um, it says
Read.
mediastinal mass.
Do you have rough demographics of age?
Yeah, like adult woman.
That one.
Yeah. Let me just back up here. Yeah, like middle aged to middle aged is I think the right description. So I think you guys can see the path. Anybody want to describe it?
It's an encapsulated lesion.
Yeah, very
As a
nice.
capsule.
Yeah,
It
correct.
has a nice fibrous tracts.
Yes,
Some
these things, right? Irene, that's what you mean? These ones, the fibrous thing. Yeah.
tracts. And when you get closer, the cells are spindle shaped
Uh-huh.
and bland.
Bland, yeah. Mm-hmm. So I think you are leading us somewhere, Irene. I'm going to wait for all three of you guys to say. So are you ready to show us your diagnosis, all three?
Yeah.
Okay, go for it.
1, 2, 3.
Irene says thymoma A, Matt says thymoma,
Yeah,
Raghav
same thing.
says thymoma. Okay, all great. Yeah, so the it was actually called at frozen section encapsulated thymoma. Yeah, so I think this is perfect. I don't think you could get a better thymoma than this on frozen. It brings up the issue of what does this change intraoperatively, because you have already taken it out,
Yeah.
and what is the point of it?
The-
So often there is no point, or sometimes the point is to to talk to the family, or to make sure that it's, I don't know what else maybe if it were lymphoma, they would yell at somebody, but it's already out. So I don't see what the point is of
If it was a carcinoid, that it's maybe a differential, no, with this.
yeah, but what would they do differently, Irene? If there's,
I don't know. Maybe the lymph nodes. Maybe they should have removed the lymph nodes. But no, it's in the mediastinum already.
It's in the mediastinum. Yeah. So the treatment of a mediastinal mass is resection, no matter what the mediastinal mass is, except lymphoma. But once you have already resected it, I don't know what the point is of a frozen section. But again, there might be points other than intraoperative management. There might be other things. You want to talk to the family. You want to, inform the patient quicker, knowing that the resection result will come out, I don't know, a week later or 5 days later or 15 days later. So maybe that's the point of doing it. But as far as pathology goes, I think you guys are spot on. This is, as good of a thymoma as could be. And in my experience, you don't always get such a great classic thymoma. Sometimes you just have to say thymic neoplasm or favor thymic, or poorly differentiated malignant neoplasm, or sometimes you just have to say cellular lesion deferred to permanent. So there's a whole spectrum of stuff that you get from the mediastinum for frozen sections. Any comments, guys? Raghav, anything to say about that?
Yeah, I was thinking the same. There's no point in doing this frozen section because it's already removed, doesn't change anything. But if the picture was not this classic, then what other differential diagnosis would you bring into this picture? Because obviously we are seeing spindle cells in the background of lymphocytes, which makes us to think in a thymoma direction. But what if I'm not seeing lymphocytes? Just spindle cells, or maybe the cells are little polygonal. Obviously, I would also bring other spindle cell tumors in the differential diagnosis. And if I look at the imaging and if I see some pleural attachment or something, then I will also bring in solitary fibrous tumor, the entire gamut of the mesenchymal neoplasms into the differential diagnosis. So those are my thoughts. And also I would carefully look at the fibrous septa and also the in between the tumor islands to see if there's any stagon type of blood vessels or any vasculature kind of thing to see if it's a soft tissue tumor which we are dealing with. And also some areas it has this rosette kind of appearance. If so obviously it can happen in thymoma because thymoma can have so many different things. But like Irene was mentioning, carcinoid it's a very close differential sometimes if we don't have lymphocytes. So I would have all these thoughts in my mind when I'm looking at this non-typical kind of frozen coming from a mediastinal mass lesion.
Raghav, do you get them at your institution? Did
No.
you ever get mediastinal frozens?
Thymoma, no. Thymoma, luckily our surgeons understand that we are not going to change anything, the pathologist's opinion, so we only get them on resections. But otherwise, mediastinal frozens, yes, we do all different kinds of stuff. But most of the times it's like lymph node or like trying to satisfy the curiosity many times.
Irene, do you get those? Do you get thymoma frozens or mediastinal frozens at your institution?
No, if it was, for example, confused by a lymph node and they thought it's a lymphoma, not for the frozen, but for sending flow cytometry or something, we could receive this. But I don't recall having seen any frozen of thymoma. Maybe metastatic, some node in the pleura or something like that, but not the mass.
But not the mass. Do you guys?
Hodgkin's is sometimes like we might get we get it means we are thinking Hodgkin's, and obviously at the back of the mind we are also thinking even if I submit to flow cytometry this may not be entirely helpful, but still we go ahead and submit the flow cytometry because I'm not an hematopathologist, so obviously I am always having the differential diagnosis Hodgkin's versus non-Hodgkin's. I still go ahead and submit it, and also primary mediastinal lymphoma. So lymphoma is one big indication where we get frozen sections.
Yeah. Mm-hmm. Do you guys want to see the permanent?
Yeah.
Yes.
Your frozen cuts
permanent.
are spectacular.
Yeah.
No, also even mats that was blood and it's so difficult to cut.
Yes.
Was very good. I'm ashamed of my cuts. I'm a very good pathologist to find out.
Absolutely, absolutely. They did a spectacular job with that case. Do you see the permanent now?
Yeah, but the frozen's almost the same as the permanent.
Almost identical. Yeah, exactly.
You're very fortunate.
Very fortunate to have good people. Actually, to be fair, the difficult ones, fat-containing lesions are difficult everywhere.
Yeah.
And non-fatty lesions are people do a good job with them everywhere. I think so. I think most places, handle the good specimens well, and the hard specimens are hard for everyone.